So I was going to focus my presentation on some aspects of partnering with industry and where it can be either advantageous or detrimental for those of us who are in the kind of clinical academic world. Generally it's considered implicit that the work that we do in biomedical research is ultimately going to enhance the quality of people's lives. And this is really the premise that we create as we write grants and try to motivate funding for our research activities. And as part of that, we exist in an ecosystem where basic research ultimately might lead to discovery, which can move into development, hopefully into new treatments. Those treatments generate clinical data, which then can inform basic research questions. So there's this circumnavigation kind of research and development focus, all central around the patient and hopefully improve value to the patient. However, the clinical translation of discoveries that we make is often impeded by a number of trans-disciplinary obstacles. One of the main ones is that the traditional funding and promotion mechanisms that we have as academic researchers tends to push us towards mechanistic questions that push the frontiers of science rather than push technology along a translational track. Many of the technologies or the discoveries we make perhaps aren't sufficiently aligned with important unmet clinical needs or lack validation in appropriate preclinical models. And importantly also, academic scientists and clinicians often lack the expertise that's required to really understand how technology and new discoveries can be brought to market. Many of the observations we make are early, and they're not considered to be clinically or commercially viable. So this really necessitates, as we make early discoveries, we need to think about where there might be unmet clinical needs, also the potential for commercial movement of these technologies through regulatory approval, clinical adoption, ultimately reimbursement by insurance companies or payers. And these barriers often prevent patients from benefiting from some of the discoveries we make because they're never really brought to market and can be put into products that patients can have clinically available. A practical barrier is this the concept that most of the translational work really is underfunded. We have funding for our basic research through government funding primarily, and the translational development is typically funded by industry. But that gap between the basic discovery and clinical translation is usually an area where there's little appetite for funding. And for us to navigate that translational area, it really requires that we think about what the ideal technology might be, both from the perspective of the clinical unmet needs in addition to ultimate commercial risk. So as we solve the technical issues in our basic research, we need to work with clinical faculty to think about where the unmet needs may be, but then also to anticipate where the challenges might be in terms of commercialization, and that requires interactions with the industry network. And these aspects of technical or scientific risk, clinical risk, and ultimately commercial risk are sequential. So we tend to focus primarily on scientific risk early on, and it's not until we partner with industry that we ultimately face these issues of clinical and commercial risks. Consequently, there's often the situation we're faced is that when we find a successful experiment, we see a good result in an animal study, we have this enthusiasm about the potential commercial application to patients that ultimately leads to this hype after early studies, but then some cynicism or kind of worries about the clinical opportunities as we start to face challenges of commercialization and clinical application. So to circumnavigate the translation of basic discoveries to treatments to patients really requires this partnership with industry so that we can anticipate where the needs are and where the market opportunities are. So how do we partner with industry? We have fundamentally different cultures in terms of how industry and academics work. In the university, we're really driven to openly advance knowledge and train scientists, where industry obviously has to focus on commercial relevance. But we do have aligned interests in the sense that if we're successful in improving health, that's valuable not only from the basic science and the goals of the university, but also in terms of what's going to produce commercial success for industry. So to try to promote these interactions, universities and industries aren't really natural partners. One of the challenges that's common is that as independent academic, that's what makes our publications valuable and our work legitimate. So maintaining that independence is really a critical component. Industry also has frustration in working with academics because there's potentially unrealistic ideas about the value of the technology we have and the amount of money that they have to spend, particularly because we don't anticipate the expenses required in taking care of this commercial risk once we've solved some of the technical challenges. There's also the potential for conflict of interest, conflict of commitment, the prospect that potential commercial and financial gain can impact our bias. The intellectual freedom and the right to publish can be impacted by partnering with industry. And also the involvement with industry might provide not an ideal environment for students because research that's negative there may be a push not to publish because it might have a negative influence on the commercial interests of the sponsor. Also, the academic resources that we might expend to partner with industry might be considered detrimental because it takes away time we have for doing fundamental research. And also the fundamental goal we have in academics may not be considered to be addressed with industry funding, which is not typically judged as on par with peer-reviewed extramural funding in terms of promotion and tenure. So what are the ways that exist that we can partner with industry, and what are some of the pros and cons? So it's common to have subcontracts, grants, material transfer agreements where you can partner with a company that's focusing on a specific research question. The pros are that the university manages the conflicts of interest, intellectual property, the license agreements, and there's transparencies maintained so that your impartiality can be assured. The cons are that the questions are primarily industry-driven, and you may have limited flexibility and independence in terms of your publication. And as I mentioned, there could be a question of getting credit from the university for that type of research for promotion. Another established model might be to start a company. You can apply for grants from SBIR. You can try to get angel funding or VC funding. In that setting, the pros are that you have control early on. There's a potential for equity, so there's a potential personal gain or gain to your department or institution that can be derived from that. And there's also the allure of having a company that you have some role in initiating. The challenges are that it's difficult to get funding for those types of ventures. It's a big time commitment, and the risk is high that 90% of companies that are started tend to fail. And part of this is the challenge of establishing and managing a team that has all the expertise to anticipate not only the technical but the clinical and commercial risk. This was a study that looked at the reasons for startup failures, and the top three all really have to do with establishing the right team. The top one is that there's not sufficient market need for the product you're developing, that you run out of money, or you don't have the right team. So there are some additional models which really uses either the government or the academic universities as a kind of a neutral convener. One of them is the National Science Foundation has an industry university cooperative research program, and here the goal for the National Science Foundation is to help facilitate consortia with industry to promote graduate training and also to promote industry-inspired fundamental research. And in this type of a model, the companies all contribute to the center. They get a break on the indirects that the university typically charges, and they also provide direction on what are industry-inspired questions that might have value both for the academics and also for the graduate students and industry partners. We've established one of these with Vijay Goyal at the University of Toledo, which is focused on musculoskeletal devices, which has linkages to the FDA, and we're looking at recruiting Ohio State University and Allegheny University as additional partners in this type of a consortium model. Another new model that the National Institute of Health is establishing, given they've been frustrated with the lack of commercial translation of tissue regeneration technologies, is to establish tissue regeneration consortium resource centers. And these centers are meant to attract new technologies that align with unmet clinical needs, and then provide customized resources that provide regulatory, manufacturing, maybe indication refinement for those technologies, with the goal over a fixed period of time to get those technologies to a successful application for a clinical trial. And so we've recently formed one of these with partnership with UCSF, Stanford, USC, UCLA, Berkeley, UC Davis. And the goal here is to recruit technologies that are focused initially in the craniofacial dental area, but they're focused on similar tissues that we often talk about in terms of bone, cartilage, ligament, and soft tissue. So the recommendations, I think, are to really be realistic about what your bandwidth is and how the collaboration with industry fits with your goals in terms of academic promotion and research funding. Establish your priorities, because partnering with industry might have a negative impact on your academic progress. I think it's also important to leverage existing programs where you can get access to expertise you might not have. For example, the NSF and NIH SBIR, STTR programs often provide facilitated access to what's called I-Core, where they train engineers and clinicians how to run companies. And a lot of programs in training entrepreneurism exist and can be university specific. I think the initial resources you get, you want to focus on the clinical and the commercial risk, because usually to get to the place where you're thinking about a new technology, a lot of the scientific risk has already been addressed. And so funding another research study with early money for trying to get a new technology going may be not advised. And then realize your limitations. I think developing a professional network of experienced individuals who can help you understand some of the clinical and commercial barriers, and partner with those individuals to build a team. And then finally, to manage expectations, because as you start taking money from industry and or individuals, they want to see a return on that investment, and there's a lot of pressure to make sure that that technology succeeds, and then you have a challenge of trying to pivot when perhaps those early studies are not successful or indicating that your technology is moving in the right direction. So thank you, and we'll wait for the end for questions, so maybe we should go right to our next presenter. And let me go over there and I'll introduce him.